So today we are discussing about spina bifida. The spina bifida is a birth defect in which the spinal column and sometimes the spinal cord do not complete their development. Spina bifida is among a group of birth defects called neural tube defects. So the spina bifida is a congenital birth defect. It is mainly caused by due to the deficiency of folic acid in first trimester of the pregnancy period. So, the spina bifida is a group of birth defect. It is a one among the group of birth defect called a neural tube defect. It is a one among the defect called neural tube defects. So, the proper definition for spina bifida is a condition that refers to a developmental defect of the spinal column in which the arches of one or more of the spinal vertebrae fail to fuse. So, it is a developmental defect of spinal column in which the arches, mainly seen as a bony arches of one or more of the spinal vertebrae, fail to fuse. So it may involve in the entire length of the neural tube or restricted to one area. Here we can see defect in the vertebrae allow spinal nerves to protrude. The spinal nerves to protrude result in a small pouch form in back of the babies. So, what are the etiologies? There are mainly four classifications of etiologies. The first one is that we previously said nutrition deficiency, the folic acid, which is helps in the neural development. In the absence of this folic acid result in spinal bifida, this mainly occur in the first trimester of the pregnancy, result in the spinal bifida. So second is genetic factors. Genetic factors, if a woman bears a child with spinal bifida, there is a chance of another child also have the um, same condition occur, and that is mainly common in females than in males. So here the ratio is female is more than in males. Then the third etiology is CSF pressure. The blockage in the circulation of CSF can cause pressure in the spine of unborn baby, which can lead to spina bifida. So the there are circulatory blockage of the CSF. We can know that ventricles that passes through the circulation of CSF. So here is a blockage result in the which can lead to the spinal bifida. So then fourth one is medication. The medications such as anticonvulsants. Anticonvulsants medications can be cause the spina bifida. Then another conditions such as diabetes, obesity and fever also increases the chance of delivering a baby with spina bifida. Next is types of spina bifida. There are mainly three types of spina bifida. First one is spina bifida occulta, second one is meningocele, and third one is myelomeningocele. The first one is spina bifida occulta. It is the least serious and most common type. We can see numerous baby with spina bifida occulta, and so it is less serious. And this is usually discovered by using X-ray or scans. Most people never became aware of these conditions. So second one is meningocele. It is the next most serious type. The occulta is less serious and most common type, but the meningocele is most serious type. Meningocele is the covering of the spinal cord, meninges. We can know that the meninges is the covering of the spinal cord, pass back through the opening in the spine to form a cyst-like swelling. So here we can see that the cyst-like swelling. So in here the meningocele, spina bifida meningocele, there is a meninges that is the covering of the spinal cord. We know that. There is an opening in the spine that result in a cyst-like swelling. That is mainly due to the covering. It is a meningocele covering, meninges covering. Then about the third one, myelomeningocele. If the spinal cord is enclosed in the cyst, this condition is called myelomeningocele. This is the most serious type of spina bifida. So the most serious type of spina bifida is myelomeningocele. If the spinal cord is enclosed in the cyst, the condition is called myelomeningocele. Spinal cord is enclosed in the cyst. It is called myelomeningocele. This is the most serious type of spina bifida. So here we can see the types of spina bifida in detail. And spinal process, spinal cord is the central, that's a passing through the central line. Then vertebral body, this is spina bifida occulta. It's a minor bulging present. Then the second one is meningocele. Here the meninges is protruded and the cerebrospinal fluid also passes, spinal cord which passes through the center. Then the third one is myelomeningocele. Here we can see the neural tissues and the nerves are enclosed enclosed to form a cyst-like structure. Here we can see that cerebrospinal fluid, meninges, etc. Then coming to the pathophysiology, here we can see that under the normal circumstances, the closure of the neural tube occurs around 23rd and 27th day or after fertilization. After the fertilization, in humans, after the fertilization, the neural tube almost closed around the 23rd and 27th day. However, if sometimes interferes, external medications such as anticonvulsants, diabetes, having relatives with the spina bifida, obesity, and an increased body temperature from a fever, it results in the neural tube fails to close properly as a result in neural tube defect. The most common location is malformation of the lumbar and sacral areas. This is very important. The lumbar and sacral areas. I repeat, under the normal circumstances, the closure of the neural tube occurs around 23rd and 27th day, 27 and 20 after the fertilization. However, if something interferes with some medication, anticonvulsants, diabetes, having related with the spina bifida, obesity, and increased body temperature, from fever result in the neural tube failed to closure. Result in what? Result in there is a malformation in the lumbar and sacral areas. So next is about the symptoms or clinical manifestations. The clinical manifestations such as rarely apparent on inspection. Rarely it is apparent on inspection. We can see the bulging or there's a malformation in the lumbar or sacral areas. Then the second one is loss of sensation below lesion. We can observe that the loss of sensation below the lesion, poor urinary and bladder control. Bladder control and urinary is poor. And the joint deformities in lower extremities. There is a joint deformities in connection between the extremities of sacrum. Then orthopedic abnormalities such as club foot, hip dislocation, scoliosis, etc. Then hydrocephalus. There's a cephalus. It is also a congenital malformations or congenital disease affecting the brain. Then swelling, then brain damage. These are the clinical manifestations readily apparent on inspection. Loss of sensation below the lesion. Below the lesion, there's a loss of sensation. Poor urinary and bladder control, joint deformities in lower extremities, orthopedic abnormalities, club foot, hip dislocation, scoliosis, hydrocephalus, swelling, brain damage. Then we can assess by history taking subjective and objective data. Then diagnostic tests such as prenatal tests such as AFP test, alpha fetoprotein screening, then ultrasound, then testing of amniotic fluid. That is a main, it's a common practice, that is testing of amniotic fluid. Here we can see that the X-ray or ultrasound scan of the neural tube defect, such as normal, occulta, meningocele, and myelomeningocele. Meningocele and myelomeningocele. So, X-ray is X-ray of the spina to rule out the occultus spinal bifida. Ultrasound of the pregnancy between 6th and 8th week. It's very important. Ultrasound of the pregnancy is between 6th and 8th week. CT scan has to rule out the hydrocephalus. Then we can use MRI, etc. Then coming to the medical management, there is no cure for spina bifida. Treatment depends upon how severe the defect is. Most children with spina bifida have a mild defect and may not need treatment. It is very important to know that treatments depend upon how severe the defect is. Most children with spina bifida have a mild defect and may not need treatment. Spina bifida, example for that is spina bifida occulta. But a child with severe defect may need surgery. So, is a child with a severe defect may need surgery. Assistive technologies, example, electric wheelchair, braces or crutches to help the child get around. Then medications involve treating the complications and signs of spina bifida. Then physiotherapy to improve day-to-day life and boost independence. Then surgical management include prenatal fetoscopic repair. The surgery involves putting the meninges back in place and closing the opening of the vertebrae. So it is mainly important. Prenatal include surgery involves putting the meninges. Surgery involves putting the meninges back in place, closing the opening of the vertebrae. First of all, we open the vertebrae and then putting the meninges back in place. And there is protruded meninges that we put it back into place. The closure of the vertebrae. Then surgery is done within 24 to 48 hours, about 1 to 2 days after birth. There is also surgery to treat hydrocephalus by placing a shunt. So the name of the surgery is prenatal fetoscopic repair. So fetal surgery is also done to promote early surgical closure of spina bifida. Here is prenatal and fetal surgery also available. Then next is about how keyholes spina bifida surgery can be performed in the womb. We can see that spina bifida is caused by problems with the development of the spinal column, causing a bulge of the baby's back. This can be picked up with the ultrasound scan. So the second doctor administered an anesthetic that sedates the mothers and prevent the baby wriggling. Then in the mother womb, we can see that the bulging. Then insert the camera and surgical tools through the incision. That's a keyhole type surgery. So insertion of the camera and surgical tool through the incisions, enabling them to push the spinal cord back into the place. During keyhole surgery, doctors make 3 small incisions across a mother's abdomen and uterus. Only 3 small incisions to the mother's abdomen and uterus. Then insertion of the camera and surgical tools through the incision, enabling them to push the spinal cord back into the place. So surgical keyhole here is about keyhole spina bifida surgery. So prenatal fetoscopic repair also include, and keyhole surgery also available. Then about the nursing management include nursing diagnosis include risk for infection, risk for impaired skin integrity, risk for injury, compromised family coping, deficient knowledge of the family caregivers. Nursing management can include pre-op and post-op, etc. Pre-op includes position the child in prone with the leg abducted reduces the tension risk of sac trauma, prone position. Then put the child in the incubator or warmer area without clothes, apply dressings, avoid drying to avoid drying of the area. Due to heat incubator, strictly use the sterile gauze as to prevent reinfection. Use normal saline or silver nitrate in dressing. Change the child's position every 2 hours, promotes circulation and prevent development of decubitus sore. Assess for signs of hydrocephalus, measures the head circumference, etc. Then post-op management include position to child in prone to avoid pressure of sutures or sideline position monitor child vital signs every 30 minutes until stable. Use all measures to avoid any infections, example hand washing, monitor and input and output chart. Encourage the mothers to continue breastfeeding if the child is breastfed. Then next manage include to address social anxiety, teach parents to observe the signs of complication, example convulsions, observe for leakage, remove the dressing after 48 hours to check any signs of bleeding or bulging. Then the main complications of spina bifida include meningitis due to infection. Meningitis, so we look after occurring of meningitis due to infection. Then hydrocephalus due to increased intracranial pressure. Hydrocephalus also causes then physical and neurological problems, example lack of normal bowel and bladder control, paralysis of leg, latex allergy, etc. So we discussed about definition, etiology types, pathophysiology, clinical manifestation, diagnostic test, medical management, nursing management, and complication. So, here is the discuss about the spina bifida chapter. Hope you all understand it, and thank you for listening.